So what is closed-loop medicine? Closed-loop medicine really has to do with the management of medicines, particularly within clinical and community healthcare environments. In the UK, in particular in England, it's been estimated that there's something like 273 million medicine errors every year just within the NHS, of which over half of those are to do with the administration of medicines to patients, and many are to do with prescription errors. So there is a real problem to be solved in terms of the management of medicines, and the way to understand closed-loop medicine is to think of this as a sort of three parts of the loop: the prescription of medicines by GPs and doctors, the supply of medicine by pharmacists, and the administration of those medicines to members of the public, to patients, by nursing staff and by community workers. Each one of which really depends on the others for ensuring that there are no mistakes in terms of what they're doing. And so essentially closed loop is about closing that loop between those three different activities. Some of that loop is closed anyway by the take-up of e-prescription across the UK. Most GPs now are issuing prescriptions using an electronic system, by the advent of electronic patient record systems. But closing the loop is really making sure that the data, the processes, and the people involved can interoperate really effectively and in a way that minimizes and eliminates errors. If you eliminate errors, then you're going to have better outcomes for your patients, you're going to have shorter hospital stays, you're going to have less risk of litigation, you're going to save money. You're also going to ensure that by eliminating unnecessary errors, you've got a better basis for evidence-based medicine in going forward. Other statistics become cleaner and better. So how can technology help in closed-loop medicines? Well, there's already a lot of technology being used across the NHS and across the healthcare sector. But in terms of closing the loop on medicine administration and medicine supply, the real sort of gold standard is to start to build on the electronic patient records and the e-prescription with additional facilities such as robotic devices which cut up blisters and barcode them and provide them in a form that's ready to be consumed by the patient. And of course there are lots and lots of data sets and systems that are being used across the healthcare sector that supplement the basics of what's actually happening in terms of the supply and administration of medicines. So one of the core things that technology can help with is in terms of identification, clear, unambiguous identification of medicines and of patients and of equipment and whatever else is involved within the closed loop. There's also the really major thing that you're dealing with, by the nature of it, you're dealing with a large volume of event data, events which occur within clinical settings. And that means that you need technology that can scale effectively, that can collect those events efficiently, store them cheaply, and provide access to them. And you need to have the kind of technology, maybe cloud-based technologies or whatever, which really allow you to do that. And then I think a third thing is really stemming from that. Having collected the data, you really need to have that ability, both to use that data in interoperable settings, but also to do the analysis and to generate information and knowledge from that data that is useful to clinicians and useful to pharmacists. And so that in healthcare is often generally termed informatics, and the technology around informatics is absolutely crucial, absolutely core. There is, though, a really important point to make here. Closed-loop medicine is not a single monolithic approach. It's about interoperability between lots of different systems, lots of different data, and really enabling people to do their job more effectively and reducing the errors that people make. That's what technology is useful for. So what advice would we give to anyone who's implementing closed-loop medicine management? Well, in our experience, some of the really core things that you've got to get right in this area are, firstly, the scale of the whole thing. Medicines, there are many of them. There are many billions of medicines, a couple of billion medicines, which are prescribed and administered just in the UK. And we've worked on European systems where they are dealing with the verification of up to 10 billion packs of prescription medicine annually. So dealing with just the sheer volume of medicines is a challenge in itself. And so really, if you're implementing this, you need to ensure that your systems can scale effectively, that you've really nailed down the scalability of the whole thing. You can manage that kind of volume of data, the collection of it, and the management of it. It's a large-scale problem. There's lots of data. And then the second thing is that the real value of implementing closed-loop medicines comes from the informatics, from being able to find a needle in the haystack, the one thing that's gone wrong in a sea of correctness. It only takes a very small percentage of mistakes to result in adverse effects on patients and even death in the worst situations. And so even a small change in the percentage of errors and reduction can really have significant effects. So it's all about being able to find the needle in the haystack, being able to find the patterns, being able to find the flags that alert to something actually going wrong. We really have had to pay a lot of attention in terms of the work that we've done to the fact that as you introduce technology to collect this information across the closed loop and make use of it, you've got to do that in a way that has virtually no impact on the way that people work. People have no tolerance. They're very busy people, and they cannot tolerate having to spend extra time messing around with different systems. What they need as a system is approaches that fit seamlessly into the way they already work today, or evolve that in a way that actually makes them more efficient and not less efficient. And so it's really important to co-produce these kind of solutions with clinical staff, with patients, and to ensure that what you produce really enhances people's approach to working, rather than is in fact a drag and has exactly the opposite effect. And the last thing that I would pull out is just simply the whole area of security. You are dealing fundamentally with aspects which impinge on patient records, but which also include a lot of other data. And so there's a real need to ensure that you've thought through the security implications from top to bottom, security in depth, not a simple monolithic approach, but an approach that really addresses the security and patient confidentiality issues in a multifaceted and well thought through way.